Hello, my name is Kelsey Leff. I'm a PharmD candidate at Purdue University, and I'm with Chad Kodiak on rotation this month. Today, we're going to talk about 4 new antipsychotic medications to look out for in 2023, and this is part 1 of 2 of the series. These are the 2 medications we'll be going over today, and we'll have a quick summary at the end. First, we're going to be talking about Zuranolone. It's also called Sage 217, as you can see in this beautiful picture right here. Zuranolone works like allopregnolone does in the brain. Allopregnolone is a natural steroid that works on GABA receptors to help modulate the GABA signaling that could be causing some of the symptoms that patients see. Zuranolone works exactly like brexanolone. If you've heard of brexanolone, it was approved for postpartum depression in 2019. It's a 60-hour continuous infusion. So here's some basics about Zuranolone. We're looking again at postpartum depression, but we're also looking at major depressive disorder. It's a 50 milligram oral tablet that's taken once daily for 14 days. Remember that 14 days because it's going to come in handy later. It's currently at the FDA looking at a new drug application. So they sent in that new drug application to the FDA. That's the last line after doing all the clinical trials, phases 1 through 3. We send in the NDA to the FDA to get the medication either approved or denied for marketing. So we're just waiting now. It was sent in December of 2022, so we've got a while to wait before we hear anything back from the FDA. So about the data that we've seen so far for Zuranolone. The first study only had 543 participants, which is a pretty small number. And we were only given results from day 0 to 45. So we don't have any long-term data on Zuranolone yet. So that includes day 0 through 14 that the medication was given, but we don't know for how long that medication is going to be active in the body. So the side effects. Short-term adverse events were considered to be mild or moderate. We did not see an increase in suicidal thoughts in those first 45 days. So what does the future look like for Zuranolone? We're looking at other indications like treatment-resistant depression and generalized anxiety disorder. Those are both in late phase 2 clinical trials, and bipolar depression, which is just started a phase 2 clinical trial. We have some more data incoming. As I talked about earlier, that Shoreline trial is looking at a year-long study of Zuranolone, especially in MDD. We want to see if we need to repeat that dose after 14 days and when that period starts, when we should do that. The next clinical trials are looking at PDD, and the landscape clinical trials are looking at MDD. Next, we're going to talk about Kar-XT. Excuse my pronunciation here. I could not find anywhere on the internet how to say this. So we have xanomeline trospium. Kar-XT works as a muscarinic M1 and M4 agonist. So it stimulates those receptors in the brain, and those receptors are located in areas of the brain that we see that are activated in psychosis and also working on cognition. So we think that activating these receptors is going to help treat some of the symptoms patients have. So Kar-XT, we're looking at indication of schizophrenia. So we're looking at it as an adjunct to current schizophrenia medications and as a monotherapy itself. It is also an oral tablet, and we are expecting the NDA to be submitted to the FDA in mid-2023. We'll see what happens with that. So about the medication itself, it's a completely new mechanism of action compared to other classes of antipsychotics. It doesn't rely on dopaminergic and serotonergic pathways activation. So what that means is that it could indirectly activate those pathways, but it does not directly activate those pathways. So the first 3 trials in the Emergent Trial series, which is what the Kar-XT trials are, were only 5 weeks long. Again, with the whole, we don't have any long-term data yet. So, and especially because it's a completely new mechanism of action, we don't know what's going to happen yet. And the side effects, again, in these studies were seen to be mild and moderate, and they were cholinergic in nature, which is important to keep in the back of your head. So what does the future look like for Kar-XT? Other indications, we're actually looking at psychosis in Alzheimer's disease, and that's a phase 2 trial right now. More data is incoming. The Diamond trials for schizophrenia, Arise trials specifically for the adjunct therapy, and the Adept trials for psychosis and Alzheimer's disease. So just a quick summary here. What's so exciting about Zuranolone? This oral medication could completely erase the need for brexanolone. And remember, brexanolone is that 60-hour continuous IV infusion that you have to be monitored in the hospital for the entirety of that treatment. So we're really excited for this new oral form, especially if it's only going to have to need 14 days of treatment. You can look at the updates in the pipeline to your right. And Kar-XT, we're excited because it's a new mechanism of action. We haven't seen it before yet. So this could work for dozens of diseases of the brain. We just don't know yet. And so here are my references. Thank you for listening to my presentation today.